Hi, welcome to the Bari Nation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
I'm Jason.
I'm Natalie.
You guys are in for a treat today. If you are watching this podcast episode, you will see three amazing faces that are joining us today. Dr. Stephen Myers, Dr. Renee Riddle, and our friend and expert in Bari Nation, Heather Baum. Hello, friends.
Hello. Nice to see you, April.
Hi.
Hello. We are so excited to have the opportunity to talk with all three of you tonight. Our topic is really about children and obesity and bariatric surgery. We want to know from the experts how we can talk to children about obesity and about our own bariatric surgery in a way that doesn't make this scary, in a way that they can understand. And then if the children in our lives or the children that we love are also experiencing obesity, how can we start the treatment process for them? How can we support them in loving and kind ways? And all three of you are really experts in this field. And I'm just going to turn the mic and the screen over to each one of you to just really quickly introduce yourselves to our audience. Dr. Myers, we'll start with you.
Sure. I'm Dr. Steve Myers, and I'm a bariatric surgeon here in Reading, Pennsylvania. And I have a clinic not only here called the Weight Loss Surgery and Wellness Center, but also where we do a large number of adults as well as children. And I also am part of a clinic at St. Christopher's Hospital for children in Philadelphia as well. So I care for children in both of those locations, and just happy to be here with you, April.
Very thankful for that. And right before we kind of start recording, we were asking you about how many procedures you had done kind of recently on children. And it was a surprising number to me. How many has it been?
So over the last year or so, we've done about 50 operations on adolescents, 15 or above. And, some of those came from each of those two clinics that I just mentioned. And they've done very well. Actually, my adolescents, I'm proud to say, do better than the adults in our practice. So they do really great. And I'm just really thrilled. And as I mentioned to you, April, now I'm focusing exclusively on children and adolescents.
Yeah. Oh, that's going to be interesting. I'm going to remind myself to ask you when we get further into this conversation, why you think they do better. And if there are anything that as adults we can learn from children to carry forward into our own adult bariatric journey, that would be good to know. Awesome. Wonderful. Well, thank you so much for joining us tonight.
Oh, you're very welcome. My pleasure.
Dr. Renee, would you like to introduce yourself?
Sure. I'm Dr. Renee Riddle. I am a general pediatrician. I practice here in Reading. I spend half of my time as a general pediatrician and half of my time doing weight management. I am board certified in obesity medicine, and I see both medical and surgery patients kind of young age all the way up until early 20s at the clinic with Dr. Myers.
And again, when we were talking before we had hit the record button, you really see children at a very young age, like 4 and 5-year-olds.
Yes. So I don't turn anybody away. If they have an interest to come in and talk about their weight, I'm happy to see them and help them start their weight journey.
Yeah. Oh my goodness. It's going to be fascinating to really kind of dive into the obesity pandemic and talk about why we're seeing it increase at such young age. That's going to be part of our conversation today. So Dr. Riddle, thank you so very much for joining us tonight.
Thank you for having me.
Yes. Miss Heather. Hi, Fred. Oh, you're muted.
I'm Heather Baum. Hi. So I came to the Weight Loss Surgery and Wellness Center first as a patient. I had a band in 2010. I developed an esophageal stricture from that. Had all the fluid taken out, regained the weight, 90 plus pounds that I had lost. And that was all during my nurse practitioner school and working full time and having 2 kids. And so I then March of 2020, third anniversary twin here with Jason, had a sleeve. And then unfortunately, I did develop severe reflux with the sleeve. And I had a conversion to bypass in 2021. So about 9 months out from the conversion, no more reflux, feeling fabulous. I'm down 143 pounds from my highest ever weight, and maintaining in the 120s, which is very exciting. And so as a nurse practitioner, I ventured to the Weight Loss Surgery and Wellness Center from acute care. I'm dual certified in family practice and acute care. And I joined the center to help inspire patients and teach patients to be successful, modeling off of my own successful journey, having overcome the obstacles that I did to get to where I'm at.
If you looked up bariatric cheerleader in the dictionary, it would be a picture of you, Heather. It just would be.
Oh, thanks.
It just would be. I mean, you have really been through it all. You and Natalie's, your stories are so similar with the multiple surgeries, with the complications, and through it all, you both have been like, nope, this is the best decision I ever made. Here's how I dealt with things head on. And just to watch you go from, the profession before growing into your bariatric life as a patient and a professional has just been like awe-inspiring. So you doing it.
And I enjoy Bari Nation very much, where I'm moderating peer-to-peer bariatric parent meetups. This month we're talking about picnic and party survival.
Right, which is, I think everybody needs that, like children or no children. We all need that information. So I am a bit of the odd man out here in this conversation. I do not have children. I have two amazing little nephews, but both of them were not kind of like aware that I was going through what I was going through when I did. So Jason, you've got children and grandbabies, right? Natalie, you yourself went through this surgery as a child the first time around. So I know that this conversation is going to be really important for you too. And then of course, Heather, you've got children.
Yeah, my kids were 1 and about 8 when I had my first surgery, and now they're 12 and 19. So they have seen me go through it all.
Yes. Well, and really in this conversation today, we're going to rely on everyone's expertise and everyone's experience, because we all are bringing something to the table. I can talk a little bit about how I live my life a little bit differently with my nephews now. So it's not so food centric, but really we want to just get down to kind of to the nitty gritty. Obesity in children. How do we talk to them about it? How do we help children kind of move through obesity if that is what they're dealing with? And then, what can we learn from the children who are going through this to make our lives better as patients ourselves? So if you guys are ready, I say we dive in.
Let's do it.
Mm-hmm.
Yep.
Let's do it. All right. So our very first question is actually going to go to Dr. Riddle. We always like to start our podcast when they're kind of technical like this, making sure we're all speaking the same language. So what is the disease of obesity and how does it happen? And is it different in children versus adults?
So obesity is very complex. It's what we call an epigenetic disease. It has to do with the environment, your genes, so the things around you, as well as what's inside your body. A lot of similarities in kids and adults exist because of that genetic factor, but then how they react with the environment tends to differ. What we're seeing now is earlier and earlier obesity. It seems like every generation it gets younger. And the concern for that is then you have a longer time with the illness of obesity. So a longer time with diseases, where right now I'm seeing kids as young as 2 and 4, and they may have parents that are obese, but their parents weren't obese until they were 12, 13, much older ages. Or if they think they weren't near as obese as these kids are. And so it's happening younger. We know this happens generationally. Babies get bigger every generation. There is some normalcy to a population getting larger, but at what point is it no longer normal? That's kind of where it's a little bit difficult to figure out. In adults, you look at the definition of obesity as straight BMI. Class 1 is 30 to 35, class 2 is 35 to 40, and class 3 is above 40. Kids are a little bit different because their body mass varies at age. We all know that babies are chubby, toddlers are skinny, and then you go through puberty and you kind of change your body build again.
Well, and you're growing so rapidly, right? I mean, those years are huge amounts of growth. Oh, so it would be difficult to classify based on.
Right. So there's not just one BMI number. We talk about percentiles, and they're population based. They've taken kids. The last update was in 2000, where they took a population, measured them, weighed them, and kind of plotted them on a curve to see what is normal. If you fall in the higher percentiles, then you're considered obese. If you fall in the lower, you're considered underweight. So instead of absolute numbers of BMI, we look at percentiles, and 85th to 95th is considered overweight category, or sort of like that BMI 25 to 30 in an adult. Class 1, it's 95th to above the 99th. And so it's different percentiles. It gets very complicated, the numbers. It's much easier to see on a graph. As they get older, closer to teenage years, it starts to trend into those same as the adult numbers by about adolescence. But in the younger kids, you can't look at an absolute number, you look at the curve. And, you know, the important thing that I always like to teach families is obesity is a disease. It's not a life choice. It's not a personal blame. It's a disease. Just like some people have high blood pressure, diabetes, heart disease, some people happen to have obesity. It doesn't define you. It's not who you are. It's just something that you have, and trying to learn and deal with it so that we can move forward and help your child be the healthiest they can be is kind of our goals.
Well, I'm glad you mentioned it that way about with the younger children, because I myself was one who grew, like we used to say, I grew up and then I would grow out, and then I would grow up again and then I would grow out again. So I was, you know, I had normal like baby chub type stuff, and then I would grow tall and skinny. And then, like, I want to say in junior high, like in my 7th grade year, I was 5'11" and weighed 150 pounds. And then by senior year in high school, I was 6'3" and weighed 170 pounds. So, I mean, I was just one of those that just kind of grew up and out, and then eventually didn't actually deal with obesity until I was in my mid to late 20s. So it was just one of those things that I definitely see how it has to change as far as classification goes, because you could get somebody like that and you don't want to pigeonhole them into a specific category of being obese if you turn around a month from now and they've lost all that chub and they're tall and skinny now.
Right. It's much more of a long-term kind of change. And, you know, sometimes in my office, because we're so used to seeing adults, I have to remind the staff, measure them at every visit because they gain height. If they gain height and they don't get weight, you know what? That's going to drop their BMI. So that's exciting. And that's the exciting part about kids. That's very different than adults. They're still growing. So if we can freeze their weight and let them grow into it, we can even out that BMI over time. So we have a lot more advantage than you do an adult. As I always say to the kids, you know, your mom or dad only grows out. You're lucky you grow up, so you get to stretch. And that's why it's great to address it as a kid, because we have so much more play while they're still growing. And those younger kids, we can really work with that.
I'm like frantically taking notes about all these questions I want to ask. Sorry.
So, April, let me add something to what Renee just said, because I see exclusively children that are in the severe obesity category, you know, the class 3 and above. Pretty much. I mean, there may be a few patients a little bit less than that, but that's who I deal with as a bariatric surgeon. One of the things that I notice is that, unfortunately, we actually contribute to the problem sometimes as physicians, because we put people on medications, children on medications that actually increase their weight. So part of what Renee does is she looks at all those medicines and tries to figure out how to change those so that they're not affecting the child so much, if it's possible. But you've got antidepressants, you have antihistamines, you have birth control issues, you have antipsychotics sometimes. All of those, you know, not every medication, but a lot of those increase your weight. And if they're diabetic, insulin increases their weight. So, I mean, to some degree, we're actually contributing to it sometimes by our medical care. So we have to be really, really nuanced about that. And there's all kinds of other things that contribute to it as well. I think our kids push mice instead of bikes. You know, sometimes little mice are on and watch the TV more, and they're not as active, you know, and I think that probably contributes to it. And the other thing that you need to know is, though, as their weight goes up, especially when you get into those teenage years, once they goes up and their weight is, their height is now stable, they have a new set point, right? Now they used to be 165 and now they're 185. That's their new weight. That's their new set point. It's not easy to move that. They gain more weight to 220. That's their new normal. You know, their hormones reset at that level, and they can lose weight, but it's very difficult. And usually the weight will come back. And we're designed to do that, to protect our weight. So I just wanted to let you know there's that part of it too. Sometimes we as parents and as doctors, we contribute to the problem, and we have to be careful to make sure that we're doing everything we can to align our children and our teens for success.
Well, and some of those asthma medications, steroid-based asthma medications
Exactly.
also as well, right?
Exactly, Jason. Exactly right. Yeah.
I was one of those kids that you know, I was obese my whole life, literally from birth. And then, you know, you get to a certain age and I was put on antidepressants. And then, you know, I had asthma, probably because like partially due to my weight. So then that crept me up probably from age 12 to 15 to that 350-pound mark. And as I was talking to my most recent surgeon, he told me about the set point. My body wants to be 350 pounds because that's what it was when I was done growing, technically. And so that kind of blew my mind. So I'm glad you brought that up because I think we are medicating a lot sooner than we should be. I know that's a topic for another time, but I know it does contribute because it happened to me.
So I'm not criticizing antidepressants. You know, I mean, our children sometimes need to be on them. I'm perfectly fine with that. But, you know, you have to be careful which antidepressant you're choosing. They may have more effect on their weight than others. So, and then we have some medications that can blunt that too, like metformin actually blunts some of those medication-related increases in weight. So there are things that we can do, but you know, just something to realize. That's why we're professionals, to look into these things. It's not obvious on the surface, and Renee works with us every day to look at their medications and what may be driving their weight.
I am just floored. I mean, I was so sick as a child and I was constantly on different medications, and I was obese. I was overweight my entire life. And then I just got to a point where I was very much obese. But just hearing you talk about this, it sounds like your obesity care is such a wraparound holistic approach to it, right? Acknowledging this is a disease. What is going on in your life that could be contributing to it? What can we do to maybe offset those things? And you really are trying to come up with this formula for each individual patient that you see. That just seems like a very different approach from what I've always heard when it comes to obesity medicine at any age.
Mm-hmm. Yeah, absolutely.
Yeah, I really love that approach at our clinic, that it is a holistic approach. We have an in-house psychologist that works with all of our patients pre, post-op, non-op, and a host of dietitians that are there for support. So it really is this wonderful holistic approach that Dr. Myers put together when he came and joined our practice.
Wow. I am just, wow. Okay. This is amazing. I'm like out of words a little bit, but I'm okay. Natalie, I did want to ask you something. What was it like to be so obese at such a young age?
Ooh, I think some days it didn't matter, right? Like some days you were just a kid and like it didn't phase you. But other days it hit you like a truck, like it hit you. Mostly I was an active kid. That was also where my mom was like, okay, like there's something going on, because I was in dance classes 5 days a week. I was, you know, playing with my friends out. I mean, I was fairly active as a kid, but I still was obese. And just little things like, you know, trying to find dance costumes or, you know, running the mile, trying to do the rope climb. all of that. I mean, I couldn't hold my weight ever, especially the rope climb, you know, being so little, but so big. And so I think it was a lot of time, it was like, oh, I'm just a kid. And then it would just like hit you like, oh, well, that feels weird. Like, why can't I do this thing that everyone else can do? Kind of. And then as I got older, it was pretty tough. I was in and out of, you know, Jenny Craig, Weight Watchers, all of that. So having different snacks and just kind of those, I don't want to say little, but those moments where you're kind of like, huh, that's weird. Why is that different? But I mean, I had a great childhood. I was very, you know, fortunate in the way that I lived. I did a lot of things, but yeah, some days it would just hit me like a freight train.
Well, and when you're, at least I remember when I was a kid, I wanted to be just like everybody else. I didn't want to be different. But when you are hit with that reality every so often, it makes it a really difficult slog through a time of life that is already difficult. So when you add in that layer of weight complexity, it's something different. And as a parent, if you don't know how to acknowledge or soothe or help your children move through those feelings, that could also be difficult.
Mm-hmm.
That's a stumbling block.
I was in, you know, therapy and things like that, but I think, and I'm not blaming my mother. She was a single mother. That's just, that is the mic drop right there. But it is hard to have those conversations. And I think she tried to reach out to resources that she had available to her at the time, because this was also 2 decades ago, right? Like, a lot has changed in the medical world as a whole, as we're hearing today. But yeah, there were definitely ways that it could have happened in a different format.
Yeah. So Dr. Riddle, Dr. Myers, and Heather, how do you recommend parents talk to children about obesity, whether it's their own obesity or if their child is experiencing obesity? Is there an approach that is kinder, softer, more effective than others?
I think I'd like to defer to Renee for that because she's the expert in talking with kids and parents.
Sure. And I'll let Heather talk about how she talked to her kids about herself. I think, you know, ideally throughout the child's whole life, when they're coming in for their well care, coming to their pediatrician family practice, you talk about the growth curve and you just talk about it as data points, and it is what it is, and address it just like you would the blood pressure or the height or the weight, and, you know, using sensitive words like, you know, your weight's a little bit unhealthy, not placing blame, talking about, you know, how they feel about their weight, what they think about it. I always ask the kids when they come out, what do you feel about your weight? And sometimes they'll say, I think it's fine. And, you know, so then we go with that. So I think you have to meet them where they're at. And sometimes kids are just really not ready. I also see kids that kind of get drug in by their parent who is more ready to address the weight than the kid. And I'll back off on that kid because we're probably not going to be successful. I'll just give some very general. Sometimes at that visit, we don't even look at the weight because it doesn't matter. They're not there. They're not ready to deal with it. Just talk about some general. I start with the principle of 5210. And I always ask the kid, have you ever heard about 5210? Most of them will say no. And I said, well, these are just healthy rules for living that everyone should be doing. And it's 5 servings of fruits and vegetables every day, 2 hours or less of screen time, 1 hour or more of active play, converting to more of organized exercise as you get older, and 0 sugary drinks. And these are just good habits that we all could work on. Where do you think you do good on those? Where do you think you don't? And then I typically help them form some goals, some things that they're ready to change. And it may be something really simple, like I'm going to only have 3 Cokes a day instead of 6. Okay, that's great. That's progress. So I think you have to meet them where they're at. It's very small, simple steps, you know, and really kind of gradual change. And we talk about rapid weight loss is not what we're looking for. You know, it's very small, gradual. In the younger kids, we're looking to just stabilize. slow down the rate of gain. And sometimes, little ones will come in and they'll still gain because they're supposed to, they're growing. But if they went from gaining 10 pounds in 3 months to gaining 5 pounds in 3 months, that is great progress. And, trying to help them make these little tiny changes towards their long-term goals and meeting them where they're at. I think bringing it up, but backing away when you realize they're not ready for it, but still not being afraid to bring it up again in the future, and see what they want. Like at my well visits, if I notice the weight is a little bit unhealthy, I'll address it. And I always offer, would you like to come back and talk about your weight in the future? Sometimes I get no, I just want to wait a year. Okay, that's fine. If you change your mind, let me know. So I think you have to be sensitive and you have to be willing to meet them where they're at, trying to set up good habits. I think like you mentioned about not making everything so food oriented, and that's tough in our culture, but also letting them know. I always talk about the no diets don't work. It's learning to have a good relationship with food and learning to enjoy it in a healthy manner and have it be part of your life, but not let it control you, and just learning to, kind of, and talking to the family about these are all changes that the families are more successful. Everybody who's willing to make the change. Don't sit out and make your kid eat differently. You have to kind of follow the same principles. If you don't like vegetables, you got to try them when your child is trying them too, and trying to help kind of do the same things.
It's good that you mentioned that though, because listen, when you think of doctor visits, even when, I myself was younger, the doctor just talks to the parent and they talk over the kid. It's always to the parent about the kid. It's never really, the kid's not really involved that much. So you bringing that approach to it, I think makes all the difference in the world, because when a child connects with you in that way and knows that you're there to talk about what they want to talk about, and you back off, like you said, when you back off whenever you don't want to push them into it, that's a huge difference. And also the other thing you were talking about is demystifying these other foods. Like, you don't make it into a good or a bad thing, because they're only going to want the thing they can't have. As a child, that's how they're wired. So if you take away the mystification and go, no, these things are okay, but they're okay in moderation, you begin to create those good habits and traits in the kids, instead of just waiting until they get to a point where they can buy it on their own. And then they're eating, they're stashing it under their bed in their room, and they eat it when you go to bed. Because we've seen that. I mean, that happens legitimately all the time, because you're just like, no, for that, you can't do that. No, that's all they're going to want to do.
Yeah, that's so true. And, and sometimes I just have to tell the parent, okay, just back off. I think we need to take a break. Why don't I see you back in 6 months? Is that okay with you? And sometimes that's just what they need, and just to check in, and, you just have to feel the situation and kind of go with the flow and sort of be there. Kids fade in and out. Sometimes I won't see a kid for 7 months and then they show up, and, I'm glad you came back, and never blame them for not showing. It's much more successful when they're ready to deal with it. You just let them know, I'm an open door. I'm here. I understand this is a journey. Some days you're going to be ready to deal with it. Sometimes you're not. And some of these kids sometimes have so much else going on. We have to take a step back and not address the weight. Maybe we have to address the mental health first, or, and get that stable. And then we can go forward, because we've helped that background stuff. So sometimes I'm just triaging out and getting some of that other help so that it can be the forefront problem.
Yeah, and it's super hard as a parent too, to know that, like, to hear it from a professional that it is time to back up, because we get so laser focused on just wanting to help our kids and not see them go through the same things we did. Right. So we're predisposed to just hover and try to do all the things and make sure that we're around them every time they get food into their mouth to say it's good or bad. And we become the gatekeeper, so to speak, of what what they're taking in. But to hear that addressed from somebody that, in your line, who can say, this isn't the time to approach that. Sometimes parents need that to think, to kind of click and go, oh, well, maybe you're right. I'm creating worse habits by trying to be overbearing about it. Not that because I just want to be overbearing, but it's because you care so much as a parent, you just don't want to see them hurt.
Right. So we're not saying, okay, we're never going to address it, but maybe we're going to take a pause for a little bit, and a lot of bariatric parents also have some really bad habits in their eating and structure. So, trying to, okay, let's try to sit down and have family meal, and let's try to do some stuff a little bit together so that, the child sees some of those good habits. And unfortunately, a lot of adults who have gone through obesity develop bad habits as kids and don't know how to eat healthy and have some of these good habits. So they don't really know how to teach their child the habit. So, talking about how can you do this? And, one of the goals oftentimes especially with younger kids, is let's just sit down together as a family and have dinner. Maybe one night a week is all we can do. Let's find some recipes and cook together with things that we enjoy. A lot of times the Blue Apron type stuff, if they can afford that, can be helpful. If not, finding, recipes online, whatever works for the family. It's the other thing is you have to meet the family where they're at. You can't ask them to do things that are completely out of their economic skill set or just their cultural beliefs, like to tell a Hispanic, don't have your rice and beans anymore. It's not going to work.
Right.
Instead, how can you have it healthier? So trying to meet the family where they are, what's important to them. And I think that's the most important for a parent, to talk with the child a little bit. Okay, what's important to them? How do you feel? Focus more on the health aspect of it, not the appearance aspect. Although I do have, teens that come into me, like Natalie was saying, I have some that will come in. And when I ask them, how do you feel about your weight? I get some of that like hit by a Mack truck story, and they will be completely honest and, spill it all out. And you have to be ready to hear that and supportive. And that's okay. That's how you feel. I always tell them, this is our conversation. It's between me, you, and whoever else is in the room. It's not going to leave here. I want you to tell me how you really feel so I can understand where you're at. And that helps me help you better. And if they say, I'm fine, that's great. You're fine. Let's see. Would you like to work on your health a little bit? You just find a different avenue.
Well, and really the amount of trust that I would assume you're building with your young patients, to have a doctor ask you these kind of heavier questions about your weight, and for a child to be able to say, I'm not comfortable, or I don't, right? And for the doctor to go, I understand. Okay. Oh my God. Like that sets that child up for a much different relationship with every medical professional for the rest of their lives, in a very positive trajectory.
Yeah, I have to say my own daughter, so she's always been on the higher end of the curve in percentiles for her weight pretty much since she was born. And she went into the hospital in January with a pretty nasty urinary tract infection. And they, noted that she was class 1 obesity for a child for her age and everything, although they measured her height wrong. So we kind of joke about that every time she goes in. They gave her a few inches and made her BMI look a little lower than it really was. But they referred her to Dr. Riddle actually just before I started working there. And it's like Dr. Riddle said, I loved how the first visit she asked Cece, how do you feel about your weight? Like, this is where your weight is on the chart, but how do you feel about it? And Cece, she's very strong-headed. She's like, I'm fine. She is. But after seeing everything that I went through, so she was 1 when I had my band, and the band was tough. I got sick a lot. Food got stuck a lot. And if mommy had a certain look on her face, nobody talked at the dinner table because something wasn't going well. So she watched me go through that. She watched me go through the regain when I had to have the fluid out of my band. So she really watched me struggle with my, journey through obesity. From the get-go, when she was little, recognizing early that she has a huge sweet tooth, and she does go for the carbs, which we've talked about with Dr. Riddle, but recognizing that early and really taking it from the aspect of, I want her to be healthy. It's not about your weight. You're beautiful as you are, but it's about your health. And I don't want to see you at an early age develop things like diabetes, high blood pressure, things that you're going to carry through your teenage years into adulthood and then continue to struggle with, because the older you get, the harder it gets. And she understands that piece. So then in working with Dr. Riddle, it's been working out kind of these, okay, well, I'm going to pack 4 out of the 5 school days because the school unfortunately doesn't have the greatest choices. I actually didn't realize that they have slushies and consider that a fruit serving at lunch, which was mind blowing to me. And I had no idea before we had this conversation with Dr. Riddle. So, you know, and that's about like, you know, if you're at your grandparents' house and they offer you something that, you know, isn't healthy, you know, how do you politely say no? How do you decline, you know, those foods without hurting grandma's feelings? Sorry, I have a tickle in my throat. And, you know, it's just teaching those good habits because she does have some good habits in place. She is very active. I am so sorry. She plays soccer. She's in color guard in the fall. In the spring, she plays lacrosse. But it's pulling those good nutritional pieces into it that's been a challenge for her.
I think that's the biggest piece that, like, it is so wonderful to hear, Dr. Riddle, that is the approach that you take. I grew up one of those kids, I think many of us have, where you go to the doctor and it feels like you're getting punished. Like, your weight isn't good, you're not healthy, you can't have this, I'll see you next time, do better, kind of a conversation. Really gave me like the white coat scaries, for lack of better terms. But to hear that is the way that addressing childhood obesity is going is one of the biggest reliefs for someone who was obese as a child. So this is like mind-blowing.
And then
especially,
oh, sorry. Yeah, I was just going to say in turn, you know, there's been some negative feedback from family members about my journey and what I've done for myself, how much weight I've lost, different things like that. And Cecilia hears these things and she's like, my mommy just wants to be healthy so that she can be here with me. So back off. That's basically her attitude towards it. So yeah, she's a sassy one. But yeah, you know, because we've always had that conversation about it's about wanting to be healthy. You know, I was not an obese child. I developed my issues with weight with both of my pregnancies. Couldn't lose the weight after the pregnancies. Had some emotional attachment to food, so that definitely played into it and didn't help the situation. But my goal always was to be healthy because as a critical care nurse, I wanted to prevent myself from being one of those patients in a bed. I didn't have high blood pressure. I didn't have diabetes. I didn't have high cholesterol or any of that with my obesity because my first surgery was at the age of 30. So, you know, it was preventing those things and always promoting it to my family and to my kids as I want to be the healthiest version of myself I can be so I can be here for my family.
I mean, I'm so uplifted by this conversation. And the thing that makes me so happy is that as an educator, I've been a public educator now for 18 years. And within about the first 6 months, maybe, of teaching, I realized these kids are way smarter than what everybody else gives them credit for. They can understand, they can reason, rationalize. They are intelligent human beings. So to have this conversation about weight through the lens that really only matters, and that is long-term health and longevity, they really do understand that. And I would imagine that as professionals in the medical field, the longer that a little tiny human lives as an obese human, the greater the risk of these very large, scary metabolic diseases comes into play. And you want to prevent that as soon as you possibly can. But you're also realizing from your professional standpoint, I can't force this on them. This has to be something that they buy into, but they are capable of understanding obesity from a wellness perspective, from that metabolic wellness perspective. They get it. And it really shifts the conversation. And especially to hear that part of the treatment is teaching kids how to kind of wiggle themselves out of food decisions that maybe are presented to them by their friends and family that they don't want to partake in. Like, I would have never, I mean, that's something that I've had to learn as an adult, but to be teaching that to kids, what a powerful tool that I would have never thought of. That's amazing. I mean, oh my gosh. Okay, Jason, the question that I want to ask you has to do with how your kids, and Heather, this is definitely for you as well. How did your kids react to your obesity? Because you both kind of, I think the weight came on when your kids could realize that you were gaining weight. So how did they deal with your obesity? And then how did you walk them through, or, how did you take them along your bariatric journey?
I know that my kids knew, they could see what was going on. They never really talked about it. They were just really accepting of the things that I eventually was no longer able to do. Like, they knew I couldn't do a lot, so they really made a lot of, because my kids were older. They were teenagers, and my son was younger, but he was he adapted very well to what his sisters would tell him, and he had a really good eye for things he knew that I wouldn't be able to do, which still like guts me to this day, because he missed out on a lot. I would always take him and do things, and like he was very super active. He played soccer, he played baseball, he was in jujitsu and mixed martial arts for 3 years, and he never missed a practice, and he would practice for like 3 hours a day. I mean, the kid's got drive like nobody else. And I would take him to do all these things. I just couldn't do it myself. And to me, that's what I feel like I missed out on a lot with him. But when they realized that it was at a detrimental point, of course, he was, 18 at the time. So he really knew. And my daughters were much older. My daughters were 24 at the time. And they, everybody rallied around me when I finally told them what, the decision was. They never really gave me any crap about how I was living or what I was doing to myself, because they just loved Dad for Dad. Like, they just knew. I mean, I was always there. I always did what I could do, and that was enough. But to me, like, knowing what all they missed out on and the things they wouldn't be able to do, like, it still kills me to know that I robbed them of that, because I can be a fantastic grandfather to my daughter's 2 girls, but that doesn't repay what they missed out on. So the things that I'm able to do with and for them, my daughter just brought it up yesterday. Like, we're taking the girls to Disney next weekend. And my daughter was just like, we didn't ever get to go to Disney. And I was like, I didn't want to tell her, like, well, hell, I couldn't walk around Disney back then. So the fact that I can do it now, and we're able to, and we just happen to have everything fall into place, like, we're going to do that. And, it's those things that are stark reminders of where I've come from. And they really rallied around me when it was time for me to make the decision to do what I was going to do. They were super excited about it. And my grandbabies have only seen me small. So they look at pictures of me before, and they're like, they say things like, well, you don't, like, what is that? Like, you don't look like that. And I said, no. I said, but I used to. And they would look like my after picture where I'm holding my shorts out, my big shorts. And they're just like, look at you with those big old shorts on. I was like, Papa, I used to fill those big old shorts. Like, I used to be all of that. And, and I'd show them the before picture. And they think it's funny. They're 3 and 5. So, they don't really get it yet. And, they ask, like, dinner time things, like when they'll want to feed me stuff or, give me things. And I'm just like, yeah, Pop-Pop's tiny tummy can't handle that. And that's all I tell you. So that's all they know. They're like, well, Pop-Pop's tiny tummy, and they know about Gia too. So anytime they try to do the same thing for Sarah, we just explain it to them that way. And so they know that we had a surgery, and they know that we used to be big and now we're not. And so as they get older, we'll talk more about it. But yeah, for right now, they just know that Pop-Pop's tiny tummy can't handle some of the foods that they get.
Dude, I had that aha moment the other day with my nephew. He's 3 and came over to our house and brought donuts. And I had a donut. I took a little piece and I had a couple bites, and that was wonderful. And William came over to me and I share my donut with you. And I said, thank you. What wonderful share. He's learning how to share. He's a terror, three-year-old. And wanted to share with me. And I said, oh no, thank you for sharing, but Auntie's full. And again, kids are smart. He knew that I wasn't forceful enough. And so he was like, no, Auntie, have a bite. And I was like, Auntie's full. No, thank you. And that tone let him know, oh, she's not interested. And it wasn't like a dig at him. He was like, okay, well, I tried, you're lost, whatever. And he moved on. But instantly that clicked in my brain. And I was like, oh my God, it's the tone. And I also just think too, like, kids again, kids are smart. They know that their parent can't handle them talking about something that their parent is struggling with. Every one of us on this have been children, and we knew what we could and could not bring up with our parents. And I think when you are that size, when you are obese and your weight is something that you are struggling with, that is broadcast out to the world and your kids pick up on it. So the fact that they know that that's not territory that is open to discuss, I think leads into a lot of the issues that we kind of, experience as adults. Heather, what about you? What was your experience?
Well, like I said, my kids were really young when I had my first surgery. They, were kind of too young to really understand what was going on. But I'm sure, Jacob is he pays attention to everything and kind of he's just very much attention to detail kind of kid. And so I think he probably observed a lot of things that maybe I didn't want him to kind of realize were going on in my own personal life with my obesity. Sitting in a pile of clothing in my closet in tears because I couldn't wear anything or fit anything, and kind of seeing those things. But I really try to never talk about the struggles with the kids, always trying to kind of put on the brave face and still go on the hikes with Boy Scouts. I was actually an assistant scoutmaster. I was never even a Girl Scout in my life, but I helped with the Boy Scouts when Jake was young. And I still, tried to do a lot of the things. And when I lost all the weight with the band, I was able to go zip lining and do the hikes and do the things. And then as I kind of regained the weight, and I was getting unhealthy again, my kids saw that I was having trouble breathing. I was having trouble walking. It really came to a head when we went to Washington, D.C. And my feet hurt, my legs hurt. I couldn't breathe. I couldn't keep up. And they kind of knew that I was struggling and kind of watched that. And I was like, all right, well, mommy had the surgery before and it worked really well. And I'm going to go have another surgery that's going to help me get healthy again. So always approaching it from that perspective that mommy's trying to get healthy, and the surgeries has helped me. So trying to put that kind of positive spin on it that, this is something I need to do for myself, that I can be here with you and do these fun things, fit in the seat on the roller coaster and keep up with the family and all of that stuff. So it's kind of, how you, approach it, but also, I'm trying to think of a good way to say it is kind of there's just so many things that you think go on behind closed doors that your kids see. You may not intend them to see it, but they do because they're observant and they take that in. And I didn't want to pass on my lack of self-confidence and those issues that I had to my kids. And obviously they have not developed that because they are very confident children and very well-spoken.
Mission accomplished, my friend.
Oh yes. Cecilia had her first boyfriend. She got mad when they broke up. So there was no tears cried in this house.
Oh my goodness. Dr. Meyer, I'd like to ask you something. You said something earlier, and I've been marinating on this, that you're seeing higher rates of success in your children than you are in your adult population. What are these kiddos doing that is allowing them to be so successful?
Well, I think a big reason that they're so successful is something that Renee mentioned. We see our children more frequently than adults. Adults you can give a list to, right? You can say, these are the 4 things I want you to do. Come back in 3 months and we'll talk about it again. And an adolescent, that's probably not going to go. You're going to have to say, which of these 4 things do you think you'd like to work on? And then come back and see me in a month. So one thing that I learned very early when I started caring for adolescents and doing bariatric surgery on adolescents is, first of all, they live in the moment. They can understand a little bit about the future, but their mind isn't generally there. It's what this surgery or what this is going to do for me now. It's going to change the way I can go to Disney. I can go on the rides. I can go on the hikes. I'm not going to be bullied like I was before. That kind of stuff. There's And of course, if they have a disease entity like diabetes, now I can get rid of my diabetes, but if they don't have that, it's hard for them to project into the future. So we've taken the tact that we want to see our children after. Of course, we see them every month before surgery for about 6 months, right, or more, maybe even a year. After surgery, we're going to keep seeing them every month. So we see them every month for like the next year. So they have better accountability. They also have a team. You generally, a 15-year-old doesn't come in and say, I want surgery. They come in with mom, and mom is not there to have their child have surgery. They have a problem. They recognize they have a problem. They're looking for a solution. And so they usually have parents that are very supportive and helpful. Let me take it to another extent. Some of the special needs kids, well, they can't, when they're 17 years old, a normal teenager can get in a car and drive to McDonald's and have as many burgers as they want. But if you're a child that has a cognitive disability or a genetic disorder, you've got a parent that's looking over you. So, both of those groups of children actually do better than adults that you say, here are the 4 things I want you to do. And some of them do, and some of them don't. So, yeah, I think that's why they do better. The other thing I want to mention to you is that all of the children, all of the teens see the pediatrician first. So Dr. Riddle will see them first and see where they are, see if they're a reasonable candidate, based on their, weight and their medical problems, but also where they are mentally. And so I get involved, and that's true in the other clinic and in St. Christopher's too. I get involved after they've looked at the options, and now their obesity is severe enough that none of the other solutions are really going to be adequate. So I usually start by saying, we do 3 things at the clinic here. We do lifestyle, dietary, behavior modification. We do that. We help you make choices in that area. Sometimes we offer medications, and sometimes surgery is the right answer. And sometimes all of them have to be done to get you your best result, both lifestyle changes, medicine, and surgery. So they can all work together. So what's the result? If you choose lifestyle and dietary instruction, maybe you lose 5% of your weight. If you're 300 pounds, maybe you lose 15 pounds, which is great, but may not be enough to solve some of the issues. If you have medicines, you'll probably be able to lose 10% of your weight. That's 30 pounds if you're 300 pounds. That's a good amount. That can certainly help you with some of your medical problems, but that's not going to get you to 170 pounds. So if what you feel like you need is something to address your weight in a more aggressive way, then that's when we say surgery can be an option. You lose about 30% of your weight. Now you're losing 100 pounds. So you have to decide what fits you. And, this is a dialogue with mom and dad in the room sometimes too. So I help them to understand what we have to offer, and then what would you like to do? And some people say, surgery. I'm not interested in surgery. Well, you can see their body mass index is 60. That's what they really need, but they're not ready for that, So, fine. Let's go down the road for a while with just the lifestyle changes, or maybe with medications, see how we do. So sometimes those children will stay in the clinic for a long time. And then finally, it's like, this is not enough. I'm ready to do something more for this. And then that's when we start talking about surgery and what that pathway would look like. So the kids actually do very well, but you have to, you have to meet them where they are, like Renee was saying, and you have to understand that they're not always where you know that they eventually should be. And you have to walk that journey with them and be willing to say, okay, that's fine. Let's go down that pathway. We'll see you in another month. You know, if you decide you need to see me again, I'm always available to see you as well. So let's see how things go. So anyhow, that's kind of the discussion that we generally have with teens.
Well, you guys should see my page of notes that I've been taking as we've had this conversation. But what is so surprising to me is that with just a few tweaks, I mean, granted, they're larger tweaks at that adult level, the care could really be the same, right? Because so many adults go into bariatric surgery without that advocacy within their own families. They might not know a single person, or they have chosen not to share with anybody else. So there's no one there to help them or to advocate with them. There's nobody joining them at these appointments. There's nobody following along with them in their binder. You know, that piece is missing. That constant checkup, that would have been amazing. And as an adult, you don't get that. I can imagine as a child to know that my doctor is on my team. That is a completely different approach.
Yeah, I frequently tell our teens, you know, I'm not on your back. I'm not on your back here. I'm on your team. So let's see what we can do together. You know?
I mean, it's just like, oh my God. I mean, it seems like if we just made these little tweaks, even at the adult level, we would see much greater rates of success, but yet we don't. Do you think there's a reason that those aren't happening?
Well,
Sorry, Jason.
I think our adults do very well too, but I guess most people think that the adolescents are not going to do that well because they're adolescents. You know, they're not as reliable, maybe not as compliant. So we just dial up the compliance by you know, seeing them more frequently, and they seem to respond very well to that. I mean, my nurses in the office often tell me, I'd rather take care of your teens, Dr. Myers, because adults will just blow me off. You know, they're not going to listen. I tell them what to do, and it's like, I'm not going to do that. You know, and the teens are like, oh yeah, okay, that makes sense. You know, they seem to be with the program. You know, so it's kind of nice.
Well, it's easy to catch them early in the fact that, like, I know for myself, I put off surgery and tried to say that, you know, it wasn't for me and I didn't need to do all that and I could do it myself and all the things we tell ourselves. But I was 44 years old. So, I mean, I had 44 years of the horrible behaviors that I had learned along the way to, you know, try to combat and turn around. So catching them earlier like that makes a huge difference before they can have so many years. Like, they only have a couple of years. They know that it sucks right now. So it's going to be a lot better if they just follow these few simple instructions and kind of make those changes now, because it's a lot easier to you know, rearrange 15 years of bad behavior than it is for 44. And I know that had I had constant support in that way from my surgical team like you guys did, I feel like my journey would have been a lot easier, and I really didn't have that hard of a journey. I was one of the, you know, lucky people that didn't really have a lot of complications, but I still feel like it would have been easier for me to get to where I am today without, you know, it would have been a whole lot less of a learning curve had I have had somebody there with me to kind of help me along the process instead of just cashing my check and being like, all right, man, take it easy. Like, hope you figure it out. I'm like, you know, your binder only says 1,200 calories and drink your water and have a good time. And you're just like, well, you know, I didn't know anything about how to get 1,200 healthy calories. So it was a bit of a shock to me. So knowing that you guys take that approach with, you know, with as many people as will accept it is amazing to me.
And there's good data around it too. The research shows that the teens do just as well as adults, and maybe a little bit better. So there's good data around that. And, you know, their risks are lower. Generally, the teens have about a 1% risk of a significant problem. So 99% of the kids are going to get through it without any difficulty. And so, you know, the risk-benefit ratio is really quite good for teens, but it's not generally thought of that way. You know, most people would say, well, you know, that's a higher risk. Why would you do that? All that kind of stuff. In fact, it's lower risk, and the results are just as good, if not better.
Yeah,
that makes sense.
Listening to you speak about, you know, I guess the stigma around adolescence, which is a stigma for good reason, 90% of the time. I remember my mom sitting me down. We decided to have the surgery. I wanted the surgery because I was 350 pounds. And at that moment in my life, I realized that I was unwell. But I remember her sitting me down and saying, okay, this is a big deal. Like, kind of that parent mode of like, please, like, don't treat this like your math homework that you lost, 5 times this week. But I remember the first year I did really well. I lost like almost 200 pounds. Like I did so well. I was like on it. I was diligent. I mean, my friends would be like, hey, do you want to go get Taco Bell? And I'd be like, yeah, but I could only have like a taco. And then I would just eat the middle. I mean, I was like, I am not messing this up, because kind of what we were talking before, like I knew if I do well here, I will be like the other kids. I can wear what the other kids wear. That was a motivator for me.
Mhm.
It only started to go downhill when, things started happening. And that's when I think I developed some other habits that weren't great after the fact. But I mean, 15-year-old Natalie was like, I'm going to fit into normal clothes. Like that was my motivator. So I totally believe that adolescents do really well. Because I lived it.
This conversation has just, opened up so many new understandings for me. I really did not understand this aspect of bariatric surgery. And it's giving me a lot of hope for a lot of different reasons, I think on a lot of different levels, just especially knowing that these types of conversations that we're having are adults are being had with children, and that stigma and that heaviness that comes with the disease of obesity is really shifting away from what we look like and you're a bad person because you are obese, to nope, you're battling a disease. Here's the approach that we're going to take. This is about your health and wellness. It is, that's a big departure from, I think, what I experienced as a child. And I think a lot of us did as well. But to also know that there's a lot of things going on in the world of childhood obesity that we can really take forward into our adult lives. And that, right, we're really learning how, because when we talk kind to children, we talk kindly to ourselves. Right, we get in that habit, or we get in that mindset, and we almost become kinder to ourselves and to other members of our own community when we learn to have these types of conversations.
Yeah.
Oh my goodness.
So
well, my friends.
Could I mention something else? And that is that I think I find some parents are very demanding of their children and say, if you're going to have this operation, you got to do it right. You got to do this. You got to do that. You'll never have this. They're very rigid about, and a lot of them have had bariatric surgery, and they're like really pounding into the kids that they have to behave in a certain way. What's lost is the operation helps them to do the right things, right? You have a gastric sleeve or gastric bypass or duodenal switch, you're decreasing their hunger drive. You're removing that part of the stomach that generates ghrelin so they don't feel so hungry. They lose weight, their insulin drive goes down. They're not craving carbs so much anymore. They empty their stomach faster after a gastric sleeve, for instance, and the other operations, and trigger gastrointestinal hormones like GLP-1, glucagon-like polypeptide 1, GLP-1. It's like being on a sliding scale of Victoza or Trulicity or something like that. So they don't, it does what we like to do with medications. It decreases their hunger even further, and they're not thinking about food as much. How cool is that? They have tools that this operation has just given them. You don't have to behave in a certain way to be successful. You don't want to sabotage yourself, but the operation itself changes your brain's ability to cope with these things. And that's why you guys are successful long-term. It's not because you have small stomachs. That's a little part of it. Big part of it is your hormones have changed, and you don't think about food as much, and you're not as hungry, and you don't have super high insulin's making you wake up at night to go to the refrigerator. I mean, these things all kind of quiet down and allow you to make good choices. Doesn't mean you still don't have the set point, but all those other things have kind of overridden those set points to help you to do the right thing. So I try to ask the parents to kind of just a minute. I'd like to take over this conversation. This is me. I do this all the time. So hang on, you have a seat over there for a minute, Mom, and let me talk to your teenager, because this is what they're going to experience. Mm-hmm. And Mom is like, almost has to, hold herself back from pounding into their kids that they have to function a certain way. You really don't need to do that. I mean, you want to give them clues as to how not to sabotage themselves, but generally it's not a willpower thing anymore. They have other things that are overriding that to help them to be successful.
Yes, 4 of us. Yeah, we know what that is like intimately. Right. Yeah, we just did it on the adults, on the adult side. Right. But what you really said, it is so very powerful. Surgery is it's a thing. It's a risk. It's something that we do. From our adult perspective, it's also a risk though if we stay obese, right? So we're able to to have that rational conversation with ourselves. But the fact that you're presenting it in such a way to the parents and the children, again, just creates that team mentality. No, we're on the same team. We're going to take in the same data. We're going to look at the same information, and then we're going to make a decision that is, that is based on your needs and where you're at and where your understanding is. And it's not that decision is set in stone today. It's that we're just going to continue to grow in our understanding. We're going to work together and we're going to figure this out. Mm-hmm. It's just such a different approach.
Well, and you have to know that the medications that we're using for obesity today are so much better than they were before. And Renee's always looking at that to try to see what medications might be acceptable to them and could really bring value to them. So I think, this isn't about, lifestyle changes or surgery. It's the whole breadth of things. And some of these people are going to gain some weight afterwards, right? Well, today we've got really effective medications that help them to stay on track. So we're in a good place now professionally to be able to help people with their weight.
Wow. I can't thank the 3 of you enough for joining us tonight. This conversation has been enlightening. It has been impactful. It's been meaningful. It's been amazing, really, truly. Thank you so very much for your time this evening.
It's such a privilege. It really is.
So I would love to be able to pass along like your contact information. Are there places where people can reach out to you if they have follow-up questions or they would just like to connect? Dr. Myers, where can they find you?
So I think my professional email is the right place to do it. And I have a little bit of a funny name. My first name is Stephen, Stephan, Myers, Myers, at Tower Health, tower like a big tower, towerhealth.org. So if you can remember all that kind of stuff, then you can send me any questions you want. I'll do my best to answer.
And Dr. Meyer, we will make sure that we link all of your contact information in the show notes as well. So people can just head right there and connect with you.
Awesome.
Miss Heather, where can people find you?
Hey, you can find me on Mary Nation. So you can message me there. You can comment on my many posts that I put up. And you can follow me on Instagram. I am balanced_life_ with Heather Baum. I changed my name a couple of times, so I have to think about it. So yes, Balanced Life with Heather Baum on Instagram. And my email might be in Mary Nation. I'm not sure, but you can always shoot me an email or message me on Instagram. That's fine.
Those direct messages on Instagram, the most powerful connections that I have made in this bariatric journey happened. Yeah, exactly. Jason, Natalie, and I literally met on Instagram, and the rest is history. Well, and you too, Heather.
Well, yeah, and I actually met accidentally some of my patients that are now my patients that I didn't know were going to be my patients on Instagram. So they've been following me for quite some time. I've been following them, and so we're connecting at support group. We're connecting on Instagram, and then they are now my patients that I'm seeing in the office. So it's really great.
So cool.
Right? When the internet actually works as it should, amazing things can happen.
Don't forget
Dr. Riddle?
Renee. Yeah.
Oh, yes. Dr. Riddle, where can they connect with you?
Sorry. Email is fine too. It's the same as Dr. Myers, Renee, RENEE.Riddle, RIDDLE, just like a joke, at towerhealth.org.
Wonderful. Well, Natalie, I think I'd like to give you kind of the final word. Is there an aha? Is there something that popped up in this conversation that is just really resonating with you?
Yeah, I mean, I think this whole conversation has been very enlightening for all of us. As someone who was obese as a child, who also had adolescent bariatric surgery, I just want to thank you both, all three of you, actually, for all that you're doing with children in your center. I think that the work that you're doing is vital for the health of our future children, and just thank you is all I really have. Is thank you for doing what you do.
It's a privilege.
Jason, my friend, you want to take us out?
Yes, I do. Thank you guys so much for joining us. Your time, your knowledge, your support means everything to us. So thank you guys again. And we want to thank the community as well, because without your support, we couldn't do what we do, and helping you guys just in turn helps us along in our journey. So we thank you guys so much. Don't forget, you guys can continue to like, share, and subscribe on all your favorite podcast players, as well as our YouTube channel. You can actually leave us voice messages on the Anchor app, which we can then incorporate into future episodes of the podcast, because we love to highlight you guys as much as possible. So thank you guys so much for that. And don't forget, at the end of the day, you've got this, we've got you, and we'll see you next time.
Awesome. Thank you, friends.
Bye-bye.
Bye.